Hello, I'm Jean Kaske, the founder and CEO of Behavioral Consulting Services, or BCS. I'm going to be talking about PASRR Level 1 screens today. I assisted in the development of the statewide Wisconsin pre-admission screen and resident review program when it started in 1994. BCS has been providing PASRR Level 2 evaluations for over 25 years. I am also on the board of the National Association of PASRR Professionals, known as NAP. BCS has a statewide network of mental health professionals, including psychologists and psychiatrists, all with years of experience working with individuals with mental illness and intellectual disabilities. PASRR stemmed from the Omnibus Budget Reconciliation Act, or OBRA. OBRA was passed in 1987, and states were required to have a PASRR program in place by 1989. In November of 1992, the Federal Healthcare Financing Administration, now called CMS, published final rules for implementing the PASRR regulations for all current and prospective nursing facility residents. The major statutory PASRR regulations can be found in 42 CFR Part 483, Subpart C. The PASRR regulations apply only to Medicaid certified nursing facilities. The Olmstead Law, which also shaped PASRR, is based on a Supreme Court decision in 1999 that determined people with disabilities have a right to receive state-funded supports and services in the community rather than institutions. The purpose of PASRR is to determine if applicants or residents of Medicaid certified nursing facilities have a mental illness or an intellectual disability, and if so, do they need nursing facility level of services? It is also to determine if an individual requires specialized psychiatric rehabilitation services if they have a mental illness, or specialized services if they have an intellectual disability. This is done to avoid placing individuals with mental illness and/or intellectual disabilities in a nursing facility without appropriate supports such as specialized services. PASRR is also utilized to determine if an individual needs placement in a more restrictive setting, such as a psychiatric hospital, or a less restrictive setting, such as a group home or community-based facility. Once we complete the Level 2 evaluation, we will notify the individual or their legal representative the results of the evaluation. The ultimate goal of PASRR is to transition individuals from nursing facilities to the community whenever possible so they can live in the least restrictive, most inclusive setting for their needs. A Level 1 screen needs to be completed if the individual is suspected of having a mental illness, an intellectual disability, or they have a change of status. More information regarding change of status screens can be found in the PowerPoint on Level 2 evaluations. Nursing facilities and hospital staff complete the Level 1 screens. Nursing facilities can claim reimbursement for Level 1s by submitting the form F01012. The form can be found on DHS's website. We will review the 4 sections of the Level 1 today. Section A pertains to diagnosis and symptoms. Section B has the short-term exemptions, which include hospital discharge, emergency placement, or respite care. Section C covers severe medical and/or cognitive deficits, and Section D provides directions to refer for a Level 2 evaluation. This is the Level 1 screen. The first page has the individual's identifying information. If there's a guardian or activated power of attorney, they need to receive a copy of page 1. The boxes regarding questions if the individual is suspected of having a mental illness or an intellectual disability must be checked in order to proceed with the Level 2 evaluation. Please fill out the Level 1 form completely and legibly. Page 2 of the Level 1 has the instructions. Make sure that a copy of the Level 1 and any other PASRR documents are kept in the resident's chart. For pre-admission screens, the Level 1 needs to be done prior to admission. Inter-facility transfers means a resident can go from one nursing facility to another without needing a new Level 1, or they can be readmitted after transferring to a hospital and back without needing a new Level 1. Keep in mind that the PASRR records need to transfer with the resident. A significant change of status requires a new Level 1. For example, if a resident has developed signs and symptoms of mental illness or has a new diagnosis of mental illness, send BCS the level 1 and the current documentation. Section A contains questions regarding mental illness and addresses information on an individual's diagnosis and medications. There are several types of psychotropic medications listed and an area to write in other medications if necessary. If anything is checked yes in Section A, please make sure to check the appropriate box at the bottom of page 1, indicating the individual is suspected of having a mental illness or an intellectual disability. Section A also identifies if the individual has displayed any signs or symptoms of mental illness, such as depression, anxiety, suicidal statements, hallucinations, delusions, psychotic symptoms, and/or mood disorders. And finally, there are questions regarding intellectual disabilities, including, but not limited to, a diagnosis, impairment of general intellectual functioning, or adaptive behavior similar to that of intellectually disabled individuals. If these conditions exist, they should be manifested before the person turns 22. For example, if an individual is in a car accident and suffered a brain injury at age 25, there's no need to refer it. Section B refers to questions regarding short-term exemptions. If an individual was in the hospital and needs a recuperative stay, they are only allowed to stay 30 days. After that, a level 2 must be completed. There are other reasons that a short-term exemption is allowed. For example, if an individual is not safe in their environment, an emergency placement allows the individuals to be immediately admitted. Respite care allows an individual to stay 7 consecutive days and up to 30 days per year if necessary. If you've answered yes to questions in Section B, the person can be admitted. Send a copy of the level 1 to BCS and the county. BCS has up to 10 days to complete a level 2 after the short-term exemption expires. The nursing facility must refer the individual to BCS before the end of the short-term exemption. Section C addresses severe medical and/or cognitive deficits. Examples of a severe medical condition include Parkinson's, COPD, Huntington's, CHF, or a terminal illness. Their medical condition should limit their ability to participate in activities. An individual with severe cognitive deficits would be someone who has dementia, Alzheimer's disease, or a similar degenerative process which substantially interferes with their independent functioning. Section D provides additional directions to refer for a level 2 evaluation, including when it is necessary to receive county approval. For more information, please refer to Form F20822. To complete a level 2, we need the diagnosis list, current medication list, and any physician's orders. If there's a psychiatric or psychological evaluation or notes, please send those to us. Send us current nursing notes, only 5 to 10 pages, social history, face sheet, history and physical, and/or physician progress notes, Section C, D, and G of the MDS if it's completed, the most recent PT, OT, and speech therapy notes if applicable. This information is also listed on BCS's fax cover letter, which is on our website. Please try to keep the total page count under 40 pages and submit the documentation to BCS within the designated timeframes. Sometimes we'll get 100 pages of documentation and it's not current. When this happens, it just slows down the process. If it is a pre-admission, we have 8 working days to complete the level 2 evaluation after we receive the level 1. We have 10 days to complete the evaluation if it is a short-term exemption. We have 30 days to complete the evaluation if the individual is already in the nursing facility. Please respond quickly to any requests we have to submit additional documentation or to discuss the case. Sometimes nursing facilities don't end up admitting an individual, but don't let us know. So if we're not aware, we keep calling to get more information. If there are no other mental health concerns, don't refer individuals who have situational depression, also known as adjustment disorder or reactive depression, if it has been diagnosed within the last 6 months. If it was diagnosed longer than 6 months ago, it is technically no longer situational depression and should be referred for a level 2. Anxiety due to terminal restlessness related to end of life. Dementia with depression, anxiety, or psychosis. Mental illness secondary to dementia. If it is not clearly stated that the mental illness is secondary to dementia, send the level 1 in and we will clarify if necessary. Mental illness due to an organic physiological condition. If psychotropic meds are clearly documented that they are used for sleep, appetite, seizures, or dementia, there's no need to send it to us. If there is not a diagnosis for the psychotropic medication, this should be clarified before sending in the level 1 for review. The PASRR level 1 process is utilized to screen for a suspicion of mental illness and/or intellectual disability. It's not a review process for medications. If you're not sure, contact us and we will help clarify if a level 1 screen needs to be sent in. Here is an example of an individual we would not do a level 2 on. Let's say they have alcohol abuse or withdrawal and receives Ativan, dementia with depression and receives Haldol and Zoloft, cirrhosis of the liver, chronic kidney disease, degenerative joint disease, hypertension, and anemia. Because the depression diagnosis is due to the dementia, we wouldn't do an evaluation. But if the depression was a separate diagnosis, then we would. Here's an example of an individual we would not do a level 2 on. If they have diabetes, hypertension, congestive heart failure, end-stage dementia, and receive trazodone for sleep. Because the antidepressant is for sleep, we wouldn't do an evaluation. Refer for a level 2 evaluation if there is any mental illness diagnosis, unless it is directly related to dementia. Some examples of mental illness include depression, anxiety, schizophrenia, psychosis, bipolar, and personality disorders. Any intellectual disability diagnosis, impairment of general intellectual functioning, or adaptive behavior similar to that of intellectually disabled individuals. Examples of an intellectual disability include developmental disability, developmental delay, mental retardation, or a traumatic brain injury prior to age 22. Contact BCS for additional guidance. We understand that each individual has differing mental health, behavioral, and medical issues. Don't be afraid to send the level 1 in to us. Approximately 25% of the level 1 screens we receive do not end up in having a level 2 done. Examples of when we would do a level 2 evaluation. Let's say if somebody has congestive heart failure, COPD, atrial fib, dementia, chronic kidney disease, diabetes, anxiety, but receives Ativan, PRN on a regular basis for more days than not. Here's another example of when we would do a level 2: schizophrenia, Parkinson's, diabetes, hypertension, degenerative joint disease, cardiomyopathy. Even though there's Parkinson's, we may still do a level 2 depending on how advanced the Parkinson's was, because there's still a diagnosis of schizophrenia. There are certain ways the diagnosis is worded that tells us if a level 2 needs to be completed. As you can see, these two examples have the exact same medical conditions, but we would look into doing a level 2 evaluation if the dementia diagnosis is separate. We would not do an evaluation if there is mental illness due to dementia or secondary to dementia. These are just a couple of examples and are not all inclusive. The PASRR process is utilized to screen for a suspicion of mental illness and/or intellectual disability. It's not a review process for medications. We assess the whole individual using a person-centered approach to determine their support needs. We look at signs and symptoms, diagnosis, medical, social, and functional information, behavioral health, and other documentation as necessary to promote the most integrated setting and maximize their quality of life. Please remember, there needs to be a corresponding diagnosis for every medication that is prescribed. This should be clearly documented prior to admission. Fill out the level 1 form completely and legibly. If we can't read the information, we will need to clarify, which will delay the process. To complete the evaluations, BCS sees individuals face-to-face via telehealth and video conferencing and/or through an extensive review of the documentation. Timeframes must be strictly adhered to so that nursing facilities remain in compliance with PASRR. Federal financial participation funds, known as FFP, may be affected if PASRR screens are not done in a timely manner. Also, state surveyors may cite facilities that are out of compliance with PASRR. BCS must receive the level 1 screen prior to admitting the individual to a nursing facility for a pre-admission screen. For short-term exemptions, we must receive it on or before the last day of the exemption. Please refer it as soon as you know that the individual will be staying longer than the allotted timeframe. BCS will complete the evaluation within 8 days for pre-admission and within 10 days after a short-term exemption has expired, if not sooner. Typically, we average 2 to 3 days to complete the level 2. Here is a flow chart on the level 1 process. If the individual is not suspected of having a mental illness or an intellectual disability, no further screening is necessary and they can be admitted. If they are suspected of having a mental illness or an intellectual disability, but qualify for a short-term exemption, the person can be admitted. Send a copy of the level 1 to BCS and the county. The nursing facility must refer the individual to BCS before the end of the short-term exemption. BCS has until the end of the short-term exemption plus up to 10 days to complete the level 2. The nursing facility will need to request another F20822 form from the county. This is the contact information of Donna Wren. She is the PASRR contract administrator. She can also answer questions or handle any concerns. You can find any PASRR forms on DHS's website. We have also included resources for additional information. There are several divisions in DHS that are involved in the PASRR process. The Division of Care and Treatment Services oversees the PASRR determinations. The Division of Medicaid Services funds the program and is responsible to ensure compliance with the PASRR process. The Division of Quality Assurance surveys the nursing facilities for PASRR compliance. This is BCS's contact information. These slides are posted on our website. The email listed is for general questions only. Contact BCS to refer a level 1 via our secure email. This PowerPoint presentation is BCS's interpretation of the current PASRR regulations. I hope this presentation was helpful. If you have any questions, feel free to contact BCS. Thank you for your time.